6 alarming symptoms you should never ignore. In our fast-paced lives, it's easy to dismiss minor aches, persistent tiredness, or unusual changes in our bodies as mere side effects of a busy schedule. We tell ourselves we'll get more sleep, eat better, or simply power through. However, our bodies have a sophisticated way of signaling when something is fundamentally wrong. Ignoring these signals can be the difference between early intervention and a serious health crisis. Dietitians from the renowned publication Eating Well, as reported by Infobuy, have highlighted 6 critical symptoms that should never be brushed aside. These are not just minor inconveniences. They are red flags waving vigorously, demanding immediate medical attention. Let's delve into these alarming signs and understand why they are so crucial. Number 1. Unexplained and rapid weight loss. What it looks like. Losing a significant amount of weight, say 5% of your body weight within 6 to 12 months without any changes to your diet or exercise routine. For a 180-pound person, that's a 9-pound drop without trying. Why it's alarming. While many might see unexpected weight loss as a welcome surprise, in medical terms, it's often a major cause for concern. The body is a finely tuned machine that typically maintains a stable weight. When this balance is disrupted without a clear reason, it indicates that the body is either not absorbing nutrients properly or is in a hypermetabolic state. Potential underlying causes. Hormonal imbalances. An overactive thyroid, hyperthyroidism, can dramatically speed up your metabolism, causing rapid weight loss, nervousness, and a rapid heartbeat. Gastrointestinal issues. Conditions like celiac disease, Crohn's disease, or chronic pancreatitis can prevent your gut from absorbing essential nutrients, a state known as malabsorption. Cancer. Many forms of cancer increase the body's energy expenditure and can lead to severe, unexplained weight loss. Diabetes undiagnosed. When your body cannot use glucose for energy, it starts burning fat and muscle, leading to weight loss. Action step. If you notice your clothes are getting loose and you can't pinpoint a reason, schedule an appointment with your doctor immediately. They will likely run blood tests and other diagnostics to find the root cause. Number 2, persistent and debilitating fatigue. What it looks like. This isn't just feeling tired after a long week, it's a constant, unrelenting exhaustion that isn't relieved by a full night's sleep or rest. It's a profound lack of energy that interferes with your work, social life, and daily activities. Why it's alarming. Chronic fatigue is your body's way of saying it's running on empty and cannot replenish its energy stores. This can be due to a simple nutrient deficiency or a sign of a more complex systemic issue. Potential underlying causes. Anemia. A deficiency in red blood cells or hemoglobin means your blood can't carry enough oxygen to your tissues, leaving you feeling weak and breathless. Vitamin deficiencies. Severe deficiencies in vitamin B12, vitamin D, or iron are classic culprits behind persistent tiredness. Thyroid disorders. Both an underactive, hypothyroidism, and an overactive thyroid can cause extreme fatigue, though through different mechanisms. Chronic conditions, like heart disease, kidney disease, autoimmune disorders like lupus or rheumatoid arthritis, and chronic fatigue syndrome itself can manifest as unshakable exhaustion. Mental health. Clinical depression and anxiety are profound causes of both mental and physical fatigue. Action step. Don't just self-diagnose with burnout. Keep a fatigue journal, noting your sleep patterns, diet, and energy levels, and bring this information to your healthcare provider for a thorough evaluation. Number 3, constant thirst and frequent urination. What it looks like. An unquenchable thirst where you find yourself drinking water constantly, but still feeling dehydrated. This is paired with a need to urinate much more frequently than usual, often disrupting your sleep with multiple trips to the bathroom at night. Why it's alarming. This duo of symptoms is a classic hallmark of your body struggling to manage its blood sugar levels. When sugar builds up in your bloodstream, your kidneys have to work overtime to filter and absorb the excess. When they can't keep up, the sugar is excreted into your urine, pulling fluids from your tissues and leading to dehydration and excessive thirst. Potential underlying causes: diabetes mellitus, type 1 or type 2. This is the most common and serious cause. The body's inability to produce or use insulin effectively leads to high blood glucose. Diabetes insipidus, a rare condition unrelated to blood sugar, it involves a problem with a hormone that regulates water balance in the body. Kidney disease. Impaired kidney function can affect the organ's ability to concentrate urine, leading to increased output. Action step. This is a non-negotiable sign to see a doctor. A simple blood glucose test can quickly determine if diabetes is the cause, allowing for prompt management to prevent serious complications. Number 4, unexplained bruising or bleeding. What it looks like: bruises that appear from minimal or no contact, frequent nosebleeds that are hard to stop, bleeding gums after gentle brushing, or unusually heavy menstrual periods. Why it's alarming? These symptoms point directly to a potential problem with your body's clotting mechanism. Your blood needs the right balance of platelets and clotting factors to seal wounds and prevent excessive bleeding. When this system is compromised, even a minor injury can lead to significant bleeding. Potential underlying causes: blood disorders like thrombocytopenia, low platelet count, hemophilia, or von Willebrand disease affect clotting. Leukemia. This cancer of the blood-forming tissues can crowd out healthy platelet-producing cells in the bone marrow. Liver disease. The liver produces many of the proteins necessary for blood clotting. Severe liver damage can impair this function. Side effects of medication. Blood thinners like warfarin or aspirin are obvious culprits, but even some antibiotics and antidepressants can affect clotting. Action step. Do not assume you are just bruise easily. Unexplained and easy bruising or bleeding warrants a complete blood count, CBC, and other coagulation tests ordered by your physician. Number 5, significant hair loss and changes in body temperature. What it looks like: not just a few strands in the shower, but noticeable thinning, bald patches, or clumps of hair coming out when you brush. This symptom is often paired with a persistent feeling of being unusually hot or cold, regardless of the environment. Why it's alarming? Hair follicles are incredibly sensitive to internal changes in the body. When they shut down, it's a sign of significant internal stress. Similarly, your body's thermostat, regulated by the thyroid gland and metabolism, is crucial for homeostasis. Potential underlying causes: hormonal imbalances. Thyroid disorders are a primary suspect. Hypothyroidism can cause hair loss, dry skin, and cold intolerance, while hyperthyroidism can lead to thinning hair and heat sensitivity. Nutrient deficiencies. A lack of iron, zinc, biotin, or protein can directly impact hair growth. Autoimmune diseases. Alopecia areata is an autoimmune condition where the immune system attacks hair follicles. Other autoimmune disorders like lupus can also cause hair loss. High levels of physical or emotional stress. A stressful event can shock the hair cycle, leading to a condition called telogen effluvium, where hair falls out several months after the stressor. Action step. Consult a dermatologist or an endocrinologist. They can perform blood tests to check hormone levels, thyroid function, and nutrient stores to identify the underlying trigger. Number 6, chest pain, shortness of breath, and heart palpitations. What it looks like. While not in the original list, it is critical to address the most alarming symptoms of all. This includes any pressure, squeezing, or pain in the chest, sudden shortness of breath without exertion, a racing, pounding, or fluttering heartbeat, palpitations, and pain that radiates to the arm, neck, or jaw. Why it's alarming? These are the hallmark signs of a heart attack or other serious cardiac events. Every minute of delay in treatment can lead to increased damage to the heart muscle. Debunking the myth. As referenced by the Australian scientists, the myth that physical exertion is inherently bad for a damaged heart has been debunked. On the contrary, supervised cardiac rehabilitation is a cornerstone of recovery. However, the sudden onset of these symptoms during rest or mild activity is a medical emergency. Action step: do not wait. Call emergency services immediately. Do not attempt to drive yourself to the hospital. Conclusion: be the advocate for your health. Your body is your most valuable asset, and its warning signals are a gift of advance notice. While this list is not exhaustive, these 6 symptoms are among the most critical to heed. Listen to your body. Trust your instincts. If something feels profoundly wrong, it probably is. Schedule that doctor's appointment, ask questions, and insist on answers. Proactive healthcare is the most powerful tool you have for a long, healthy, and vibrant life.